Hi, I'm Dr. Jane Murray and I'm a mental health nurse from England. I'm the nursing director for a BSc in nursing science at Kaplan. This is a relatively new but developing programme which provides exciting opportunities for a whole range of nurses to come and develop their skills. The whole spectrum of research is developing massively at the moment in terms of dementia research. My main interest is around people with dementia, so communication, lie-telling, truth-telling, and how we support people with dementia and their families. But globally, there's a massive push to improve diagnosis. That's both at a cellular level and a history-taking level, and looking at scans and blood tests and various other much quicker processes to diagnose dementia. Dementia is quite difficult to diagnose because it has such a range of symptoms, but there is a global push to show that we need to diagnose much earlier so that people can make decisions about their treatment. The other big area is in terms of treatment for people with dementia. So there's lots of new drugs coming through. However, the research around these, although promising, there's still quite a lot of side effects coming with those drugs, and some people would choose not to take them. With the current population that we have of people with dementia, it's really important we need to continue to research the social and more qualitative aspects to support people who have dementia now. For me, people with dementia are still people, and we have to avoid labelling. Society has to become kinder and more accepting of people and less judgmental. And that's not just for people with dementia, that's looking at people with autism or lots of other neurodiverse illnesses. I think people need to have a much greater awareness of dementia, because that way we can help to support people and give them more confidence to maintain their own independence out in society. As health professionals, we have a massive role in raising awareness and asking the right questions, and also helping to destigmatise the word dementia. As health professionals, we become very anxious. We see dementia on somebody's notes and we make a judgment. And also we have to be prepared to treat people with dementia. One of the issues becomes, if you have dementia, you often experience diagnostic overshadowing, where everything that then happens to you is attributed to the dementia. So it's about having a fair society. It starts with health professionals not making a judgment, and with health professionals trying to reduce family anxiety and reduce anxiety for the person with dementia by raising awareness and increasing their education and own knowledge about dementia. This programme has been built up and developed over a period of years. I've worked very hard as the programme director to make sure that this programme has been developed for Singaporean nurses and people who will work in Singapore. The programme is scaffolded across 8 modules, and we start with research, and it's really important to remember that research underpins everything that we do as health professionals. We then move on to innovations to look at how do current innovations support good healthcare. That's really important, particularly in a country like Singapore, where it's very technology driven. So we have to look to technology to support the healthcare workers that we have. We move on to teaching and learning and health promotion. These are key areas for nurses because we spend a lot of time teaching families and teaching patients, not just other staff and students. So we look at different strategies. This underpins the health promotion module. In year 2, we move on to the ethics and law module. This is then supported by complex needs in older people. This is a very in-depth look at supporting older people who often have multimorbidity, many conditions, and how we look at the complexity of those. The final 2 modules are about clinical decision making in health assessment. The final bit is about leading and improving practice. So the 2-year programme scaffolds your learning across that period of time, building on each module and going back and helping people to reflect on their practice. It future-proofs people so that they're able to think about their nursing career going forward and perhaps where they want to be in which area. I've been a nurse for more than 30 years in the UK, and I've loved most of it. It's an absolute privilege to be able to support people, and it now offers so many opportunities. You could work in a hospital, you could work in the Institute for Mental Health. There's a move towards having nurses in schools, and obviously it opens the door to be able to work internationally, either in Singapore and some of the private hospitals. Bearing in mind I trained in England and I've taught in China, Malaysia, Borneo and now Singapore. Nursing is just an amazing career that offers you a whole range of opportunities, so come and join us. See you at Kaplan in Singapore.